we're exporting a whole lot of really bad and dangerous rhetoric, bad research, and unfortunately it's being picked up and amplified in other countries.
Never forget the elephant in the room. It's actually such a big elephant that I don't think people can even breathe in that room. It's such a huge elephant. It's number one reason of the number one preventable cause of death in Australia. So when you are taking a precautionary approach, when you're like, no, we just don't know enough, I just tell them to shut up, because that just I don't know is killing people right now.
So we know that vaping nicotine is not risk-free. Nothing's as good as fresh air, and nothing's risk-free. But the Royal College of Physicians in the UK, Public Health England, have reviewed comprehensively the literature and have found that, concluded that vaping nicotine is at least 95% safer over the long term than smoking cigarettes.
It's not about really quitting smoking. Their ideological viewpoint against vaping is so strong and so weird. Like, honestly, it's just weird. I don't know why it invokes this incredible sort of anger from these people. I mean, this colleague of mine said to me when I first moved to get the inquiry up, her comment to me was, why don't they just use a patch? And I said to her, do you smoke? And she's like, no. I said, have you ever smoked? And she said, no. And I said, well, shut up then. You don't know how hard it is to quit smoking.
And unfortunately, we're putting people in the choice of either being criminals or running the risk of a 2 in 3 death from smoking. And we shouldn't be putting people in that position.
No. Clearly, when you tell teenagers not to do something, there's a good chance they will do it.
I had to make sure the screen changed. Hello, everyone, and welcome to Son of Liberty Radio here on the Smoke Free Radio Network. I'm Patrick. Kevin's not able to be here tonight. He had a tragic death in his family. So everybody go ahead and go to his, not right now, but afterwards, go and give him your wishes, your well wishes, and your sympathy on his Facebook. Or if you have him in PM, he's probably busy, so don't hit him up there. But hello, I see Omicidal is here, Omicidal Maniac, and Mallory, and Tom Morowitz, and Troop, and Art Davis, and Paul. Paul is here, and Squonkus, and Leanna, and other people are filing in. This week has been pretty hairy here in the States. Lots of Pippa. Hello, Pippa. Lots of bad news for people in the States, but all this stuff happened after I had already planned the show, and I'm sure we'll discuss it. But we have a guest tonight that a couple people really wanted to be on the show, and I've wanted to get him on the show, but I just never thought that he would agree to come and hang out with us. But he agreed. Dr. Colin Mendelsohn is here, and we're going to talk about vaping as a medical professional, as a clinician and a doctor. How does he cope with talking to his patients about vaping and about smoking cessation and tobacco harm reduction and so forth and so on? Because, we had Senator Holly Hughes on the show, and she said that it was Colin that got her off of the cigarettes quite accidentally. She went in to learn about vaping and ended up following the doctor's suggestions and trying some things out. And so we're going to talk about that. We're going to talk about harm reduction in general. We're going to talk about his history as a doctor and being, somebody that doesn't use this technology, but knows that it helps people, and he wants to help his patients not die. So without any more, Skip Murray's in the room. Hey, Skip, tell your husband, Mark, that I love him and appreciate all of his good artistic efforts. But anyway, let's welcome Dr. Colin Mendelsohn to the show.
Hello, Patrick. Hello, good evening.
Well, yeah, what is it, midday in Australia?
Yeah, midday, yeah, right and early.
So at least here, it's just 9 p.m. here, so it's not too late for me. But we've had you on the show even when you weren't on the show, because we played some clips from the Senate Select Committee on Tobacco Control or Tobacco Harm Reduction in Australia that was chaired by Senator Holly Hughes. So we've heard you before. So, we know that you're a very intelligent man who really cares about his patients, because you're willing to go out of the norm, the socially acceptable, or the medically, well, it is medically acceptable, but the practice of doctors in Australia and pretty much doctors all over the world sort of refuse to agree on vaping. So I just wanted to, thank you for coming on, but just sort of introduce yourself. I mean, people know who you are, but it's good to have it all on recording.
Yeah, okay. So look, I've worked as a doctor for longer than I care to remember. I developed an interest in smoking cessation about 30 years ago, and I got involved in a program teaching through the university, teaching Australian doctors about smoking. But, even as a smoking doctor, it was really frustrating. I mean, we all know how difficult it is to quit, and most of the people I treated with the best practice medical interventions failed, and it's really frustrating. I was supposed to be the smoking doctor, and even I couldn't get people to quit. And then vaping hit the scene, and people were telling me they were quitting. Looked up the literature, and I've been following it ever since, and the evidence is really clear that this works. And I went to London in 2015, which was the epicenter of vaping research back then, and I met up with Clive Bates, Martin Dockrell, Peter Hayek, and came back quite inspired and started using it with my patients, and I had terrific results. It doesn't work for everyone, but it worked for a lot of people who couldn't quit with other methods. But the opposition in Australia has been horrendous. All the government authorities, health and medical associations, the health charities, the tobacco control people are all violently opposed to vaping. So several colleagues and I started the Australian Tobacco Harm Reduction Association, which is a health promotion charity to raise awareness of vaping and to advocate for it. I became an associate professor at the University of New South Wales in public health and used that as a platform, which was helpful. I'm on the committee that develops the Australian guidelines on smoking cessation. We talked about vaping. I wasn't allowed to vote on it because I'm biased, apparently, but nevertheless, the committee voted. They couldn't ignore the evidence. They voted that vaping should be a second-line treatment, medical treatment, which requires a prescription. And that's where we're at today. We still have huge opposition against vaping. You can't just go into a vape shop and buy your nicotine. You can't even buy it in Australia. And it's very hard for vapers to get accurate information about vaping. It's very hard for them to get their nicotine, and certainly for smokers who are starting from scratch, it's very difficult.
So if a patient comes to you and says, "Doctor, I want to quit smoking, but I've tried Champix, and I've tried the lozenges and the oral sprays, and nothing works." How do you go through that consultation?
Yeah, look, I discussed whether vaping would be appropriate for them. So it's particularly important for people for whom that habit is really important. The hand to mouth, the sensory aspects of smoking, the throat hit, all that stuff that smokers really miss when they quit. And you need to assess whether people need the nicotine. Some don't, some need lots. So we make that decision, and then we talk about the different models. And what's most popular in Australia, certainly for transition, is pod vapes. So most people want something simple, and also disposables. There are some good quality disposables, and the whole idea is to get people off the cigarettes. That's my goal as a doctor, to get them off the smoking. Now, if they want to go on to use a billet box like you do, or something a little bit fancier later on, that's fine. I don't have a problem with that. As far as I'm concerned, when they get off smoking, my job's done. But in Australia, the view is they need to actually get off the nicotine. And as you know, there are lots of benefits of nicotine. I mean, it's very addictive, but it helps your concentration, it keeps your weight down, helps you to think clearly. It's good for a whole variety. I know I wasn't talking about you, I'm talking about other people. It's good for a whole range of medical conditions. It improves schizophrenia, Parkinson's disease, ulcerative colitis. It helps people to relax. It's good for their mood. A lot of people just can't stop it, and they shouldn't. But, you know, you're not allowed to mention that in Australia. And you're certainly not allowed to mention that people actually enjoy vaping. You know, vaping it's immoral, using an addictive drug. And we're not allowed to mention that actually people get pleasure out of it. So I tell people to stop smoking when they can, transition to the vape when they're able to, and stop that if they can. But of course, it's much safer to stay on vaping if the alternative is to go back to smoking. I mean, that's a no-brainer.
Right. I mean, we had Dr. Charles Gardner on talking about neurodiversity, and you know what helps people that are not neurotypical. What we talked about psilocybin and different things that are sort of taboo. Magic mushrooms are not really very popular in a lot of circles, but I mean, there's evidence that shows that psilocybin in small doses can help people quit smoking in one dose. But we're not promoting that.
I don't care what works, but what I am concerned about is there's good evidence for vaping. I mean, my practice has always been about evidence-based treatment. I like to see the evidence. I mean, my science background is scientific. The evidence is there for vaping, and unfortunately people aren't seeing the evidence because the dominant narrative in Australia is that, well, we don't even know if it works. The kids are using it and being scarred for life, and one day we might find all these people grow horns and a tail. I mean, it's just nonsense. And you've got to compare that to the risks from smoking. We know up to 2 in 3 people will die from their smoking. So how can you withhold? I mean, morally as a doctor, ethically, how can you withhold something that's going to get people off the most likely thing to kill them? You can't justify that.
I mean, as a therapist, I mean, I work in physical therapy. Part of our code, part of our practice act is that everything that we do be evidence-based intervention.
Yeah.
We have somewhere, I mean, depending on who you believe, somewhere around 20 million, if not more, people that have quit smoking in the world with vaping.
Oh, and more.
How much more evidence do you need than multi-millions of people across the globe?
But that's where you're wrong, Patrick, because they're just anecdotes.
Yes. I actually used that word today. I actually used that word today in a tweet. Speaking of the Senate Select Committee on Tobacco Harm Reduction in Australia, I watched every one of the hearings from over here in the States, and to hear one of the people that were testifying refer to all of the anecdotal quitters and to diminish the value of every one of those people's quit stories is ridiculous. And they do it here in the States as well. It's just that, I was glad that Holly actually brought that, turned around and brought that to bear and apologized for that behavior. But because she herself knows that it works.
Yeah, that's right. And the interesting thing is that people like Simon Chapman, who is one of our well-known anti-vaping tobacco control experts.
We have another name for him, but I won't say it. I'll be respectable.
But he's very opposed to anecdotes. He's science-based, apparently, but he's very quick to use anecdotes. So he's very quick to report on, an exploding vape, which is an anecdote. He's very quick. In an article just a couple of days ago, he referred to his granddaughter said that her friends are vaping because they like the lemonade, and therefore all kids are vaping and doing it for fun reasons like that. I think that's an anecdote, and but it's okay for him to use anecdotes. But the anecdotes of the millions and millions of vapors that you're talking about and the thousands that I see are very compelling. And when you add that to all the scientific evidence, you can't ignore the anecdotes. They're not scientific proof, but you can't ignore them. And it adds to the compelling evidence that vaping works.
Well, I mean, one of the reasons why we stepped out of the United States and started bringing guests in from all over the world was to get their version of how it worked, their quit stories, so that we could play their quit stories alongside our quit stories and basically say, look, they're identical. Their stories are identical to ours. They couldn't quit. They tried other things and it didn't work. And then they found vaping and it worked. And that guy's from India. Oh, here's a guy from Norway. Let's ask him the same questions. His story is identical to that. We talked to Henij in Thailand. Same exact, almost beat for beat, the same stories. And it can't be, they're there for years, when the UK, came out with their, nicotine without smoke, the original report. Here in the States, when we would bring that up and we would show this to politicians and they would say, well, that's in the UK. They're different than us. And and I'm like, how anatomically, could you explain to me how, people that are in the UK, how their lungs are different than our lungs and how their brains are different than our brains and how this works differently for them than it does for us. Could you please, as a politician, explain this to me? Because I actually have, I have degrees in health sciences and all sorts of science, and none of the things that you're saying make any sense to somebody that's actually, done postmortem examinations on dead bodies and knows exactly how the human body works. Could you tell me how exactly lungs from people or in people from different countries are different than American lungs? And in one ear and out the other.
The trouble is they're not listening. They've made up their minds. They're sort of locked into this position, and there's confirmation bias and groupthink or tribal loyalties, a whole range of factors that are preventing them from actually backing down and changing their positions. So they're just not listening. I mean, we know the evidence. The evidence is straightforward, but this isn't about the evidence anymore. You can argue the evidence, but their views are increasingly influenced by moral values, by political considerations, by vested interests, financial considerations, different priorities, a whole range of other factors other than the evidence. And talking about the evidence to these people is kind of missing the point. I mean, it's not the way we're used to working with evidence. We should, public health policy should be evidence driven, but it's agenda driven.
Well, I mean, obviously there's a financial, when you have billionaires like Michael Bloomberg throwing money around all over the world and in low to middle income countries and even in developed countries, saying basically, hey, if you institute what I want to be instituted, here's a check,
Yeah, and I think these countries are influenced by the World Health Organization, which is Bloomberg funded. So
$700 million last year.
Yeah. So I mean, they haven't got the resources to do a full assessment of their own. The World Health Organization says we can't have this vaping. You need to ban that. Well, that's going to have an influence.
Yeah, I mean, when they have, especially now during this COVID pandemic all over the world, we have countries that can't afford to buy Moderna or the Johnson & Johnson, or they just can't afford to get the vaccine. Any amount of money coming into their country earmarked for public health can be diverted into buying vaccines. And the countries, my wife is from the Philippines, and obviously we know that Bloomberg has exercised an undue amount of pressure in the Philippines, and has now been brought into the light. But that's a very, very poor country, and when somebody can write a check, it gets a lot of action over there.
And the whole social justice issue is very important here. In Australia, and I'm sure like in the US and in most other countries, smoking rates are highest amongst the most disadvantaged people, the people with the least amount of money, people with mental illness, with people who who have substance problems, low income people. They're the people who can least afford to smoke. And there's financially, and there's a huge health disparity because of smoking. Well, vaping is an opportunity to save them. I mean, in Australia, we have the highest cigarette prices in the world. So in Australia, a pack of 20 Marlboros, $35 Australian. In the US, the equivalent price is about $10 Australian. Mm-hmm. In the UK, it's about $20 Australian.
Right. I mean, there are exceptions to that. I mean, here in Texas, a pack of cigarettes might be $6, but you go to New York or San Francisco, and you're looking at $15, $20, $30 for a pack of cigarettes. So, it averages out, but it's Henage is in the room. Hello, Henage.
Hey, H.
Somebody said hello to you, and it already scrolled. Peter Walker says hello.
Oh, hello, Peter. I see Peter on Twitter.
I mean, most of the Twitter mafia are in the chat room here, or a good bit of them are. There's a second Twitter event still going on. I think Greg Conley from the AVA is using Twitter Spaces. I think he's still going, but I stopped to talk to you and to start the show. But it saddens me that something like, I mean, in many facets of our society, I did a whole thread on Twitter about this, about harm reduction and different harm reduction devices and inventions and protocols that are in place that we embrace and we don't complain about on a daily basis. Seatbelts in cars, life preservers on boats, fire extinguishers, all these things that we take for granted. Making your kid wear a helmet when he's riding his bicycle, elbow pads, all this stuff. And here in the States, I mean, they're still dragging their feet on safe injection sites and clean needle exchanges and things that they know reduce harm. Birth control, handing out birth control. They still, I'm a fairly conservative person, but I understand that kids are going to be kids, and you should educate them and make sure that they don't ruin their future by having making a mistake. So here in the States, we embrace harm reduction. We make people take a test to get their driver's license, and when it comes to tobacco harm reduction, they could care less.
This is the great hypocrisy, isn't it? And in Australia, we embrace drug harm reduction. We do now have drug injecting rooms. We have needle exchanges. We give methadone to heroin users, and we acknowledge how valuable that is. I mean, the fact is that people engage in risky behaviours, and they're going to do it, whether we like it or not. And we need to stop them from dying. That's the priority. We can't stop them from doing it, but as a sort of humane society, we need to prevent all the harm that we can prevent. But what's interesting too is that most of these harm reduction strategies, when they're introduced, there's incredible hostile resistance to them. And that's been the case with all of the things you've mentioned, like seatbelts. When they came out, people said, but people are going to drive faster because they're wearing a seatbelt. Or what if they have an accident? We won't be able to get them out. There were a lot of people who objected to it. And the same with all the drug harm reduction things, pill testing at festivals. It's starting to come in Australia, but there's hostile resistance to that. And then people look back 20 years later and say, well, hello, this is really useful. Why did we leave it so long? And we're doing it again with tobacco harm reduction. We don't seem to learn.
One of the things that interested me about having you on the show, especially, was talking about the prescription model. That's imminent. If it, yeah.
Yeah.
How many doctors in Australia are actually on board with writing these prescriptions?
Yeah, look, doctors have been fed negative information for years about vaping. So all our health departments in Australia, the health charities, lung and heart and charities, medical associations, the AMA, all that tobacco control people have all been opposed to vaping. So there's been this constant barrage of misinformation. Doctors are told, oh, these drugs, these vape products aren't approved. You don't know what your patients are getting. And look, they're very concerned about vaping. Based on what they've been told, and the surveys have shown that doctors get their information from the media, not from medical journals. So on vaping, and there was an international study by Australian academics that found that they know about as much as the average person in the street. So when it comes to providing support for vapers, I mean, A, they don't know anything about it because they haven't been trained, and B, they've been misinformed repeatedly over a long period of time. So yeah, there's 8 or 9 doctors that I know of that will write prescriptions for nicotine, which is what people need to vape legally. But there's perhaps 700,000 vapers in Australia, and they're going to be going to their doctor. They are going to their doctors, and they're being told, "Well, I don't know anything about vaping. I don't know how to write a prescription. I'm not even sure if I'm allowed to write the prescription," and they're getting sent away. And that's the mess we're facing. And from the 1st of October, vapers who have nicotine or trying to pour it will be in big trouble.
Yeah, when the whole idea of the prescription model was sort of introduced, I had Paul Blemeyer on the show, and Vaping Bogan came on the show, and one of the things that I pointed out as a somebody that works in healthcare was that specific thing. Doctors aren't going to write a prescription until they've been educated on how to do it. I said nobody thought about making sure the infrastructure was robust, and that it could handle this. And I mentioned that months and months and months and months ago, and it doesn't seem like anybody in power has made any move. And I know I followed you on Twitter, and I follow Athra on Twitter, and seeing that my same concerns were your same concerns, and there was already a list made in Australia of that 8 or 9 doctors, and then it went down because somebody retired. I think, or I think I saw it went from like 10 to 9 or something, and I was like, "This is not good. This is not good."
And doctors are not getting any education. There is no official education. The College of General Practitioners is not providing education. I've run a couple of webinars, tried to write articles. You've got no idea how hard it is to get an article in Australian medical journals published about vaping. I can't believe how, because the trouble is you send in an article about the evidence on vaping and it gets rejected. The reviewers who are opposed to vaping come up with all these reasons why it shouldn't be published. So we now have a situation where there is no, or very little evidence available, and there's no formal education. I've run a couple of webinars, and I have had a few things published, but and I've published stuff online, but it's very hard to get doctors informed.
Yeah, I mean, obviously, we had Dr. Glover on the show from New Zealand, and she's the section editor for the Harm Reduction Journal on tobacco, the tobacco section editor, and she's been on the show multiple times talking about how difficult it is just to find doctors that would agree, or academics that would agree to do the peer review.
Yeah.
So that so that she could get it published. That nobody wanted to. I mean, obviously, she's not the most popular person in academia. Obviously, they tried to blackball her multiple times, and they got her kicked off Twitter for a long time. So she's already sort of at a negative there. I mean, but just to the fact that people are academics are unwilling to put their name on a study about vaping because they don't want to be in trouble with their friends or with their other doctors.
That's right. I mean, it's very tribal, and if you stick your head out, you'll take a bullet. And also, there's all this tribal stuff where, well, if the rest of the AMA is opposed to vaping, and I suggest otherwise, then you're going to be clearly, you're going to lose friendships, associations. You're going to be criticised, and for academics, it's also about funding. The health organisations that provide funding, it's just like in the US with the NIH. If they're opposed to vaping, they're only going to fund academics who support vaping and who support their agenda. And we have that in Australia as well. And the other thing in Australia is, because nicotine is a prescription product, unlike in the US, you can't advertise or even promote it. So if I go online and say, I prescribe nicotine, that's actually an offence.
Mm-hmm.
Because you're not allowed to say you prescribe or you support vaping as a doctor.
Here in the United States, pharmaceutical companies are probably one of the biggest advertisers, on network TV. You can't have a commercial block without seeing an advertisement for some drug, whether it helps with your diarrhea or whatever, and then at the end there's an audio blast for about 30 seconds of the fastest talker you could possibly hire, naming off all of the side effects and deleterious effects of taking this pharmaceutical product. And we have a product that has never harmed a user when used appropriately. No serious harm. And I think that's one of the disturbing aspects of this debate, that there's a lot of attempts to silence people who speak about the alternative view. That really is disappointing, because we're not having a proper debate. We're sort of saying, well, this is what we think, and we don't want to hear the other point of view. So we're not going to let other people present their story, and we're certainly not going to let doctors say, oh, I prescribe nicotine, because we need to contain this in spite of the evidence. Peter's asking a question in chat. He says, do you ever feel segregated for voicing the truth?
Look, not really. It doesn't bother me. I know I'm doing the right thing, and I know there are a lot of people who are opposed, but I just feel so strongly about this, and I guess I'm towards the end of my career. So, that sort of thing would worry me less. Early on in my career, it would certainly close off opportunities. So you're going
to be working until you're 90, sir. So
probably
you got another 40 years.
Look, I've taken a lot of flack. I have been called out as being a shill of big tobacco. In publications, I've been told I collect tobacco money for every time I go on in the media.
I've actually seen that.
Yeah,
I've seen them.
They try. There are lots of dirty tricks to keep people from telling the true story.
Yeah, I saw during again, we're going to refer back to the Senate Select Committee, when you and Alex Wodek were talking. He had I think the best response I've ever seen to that suggestion that he was a tobacco shill. I loved that. I mean, he basically said, look, I was a doctor in England, which is a public health system, and they collect tobacco tax, and I came here and I was a doctor in Sydney, and it's a public health system here, and the government collects tobacco tax, and I imagine that some portion of my paycheck came from tobacco tax money. But hey, all of you, politicians that are in the room here, you're all government employees and collect a paycheck from the government. And guess what? Some of your money came from tobacco tax too. I think that was probably the the best response I've ever seen.
Yeah, it was a good comeback. And of course, Alex and I have never collected a cent from tobacco or the vape industries. And all our advocacy is done at our own expense, you know, whether it means going to Canberra to give evidence and all the other things we do. But, you know, the problem for the people, the anti-vaping people, is that they haven't got evidence to challenge us. So it becomes an ad hominem attack, ad hominem attack. That's the only way they can undermine us, because, you know, the evidence speaks for itself.
Yeah, I did see that you posted a new blog today.
Yeah.
I do like the graphic of the very frightened mother here.
Yeah. And this is the strategy. The strategy is to generate panic about young people vaping, because that's going to get support in the community. People will read the headlines. And this was based on an article in one of our leading newspapers, which basically made out that all the kids were using high levels of nicotine in vaping products, and there were serious lung and health and brain risks from this. There were serious nicotine poisoning and addiction problems. But it was a very unbalanced article and very emotive. And, you know, I just felt we needed to call it out. And the trouble is, I can write a blog, but I can't get that into the mainstream media. So the message gets out to people that, oh, all the kids are using vapes, and they're all getting brain damage, and, you know, we've got all these kids will have a lifetime of nicotine addiction. There's so much wrong with all that, but we can't challenge it.
Hello, Jeffrey Zamora.
Sorry?
I was saying hello to Jeffrey Zamora. He's one of our Central and South American advocates. Yeah, you know, the sad thing is, and I have you know, Julie Wassner from CASA and INCO in the introduction talking about how we are exporting from the United States all of our bad stuff to other countries. And I've seen video of Greg Hunt. Normally I call him something else, but since you're on the show, I won't call him that thing that I normally call him. Basically using the American E-Valley scare as a justification for passing legislation in Australia, which I think is hilarious, because not a single case of E-Valley or whatever you want to call it, you know, they've changed the name, ever was on Australian shores. But, you know, they're going to use, you know, American tactics in other countries, and it's ridiculous. You know, and I saw the clip that I took the two pieces from our intro from where you were being interviewed on Australian TV, and they were going pretty straight at you on the E-Valley thing, and kept bringing it up, and you kept trying to say, no, this is not, you know, none of the cases in the United States were actually nicotine vaping products. These were vitamin E acetate illicit THC cartridges. But they repeatedly asked you the same question, and I think they gave up because you stuck to your guns. But it saddens me. About 2 years ago, there was a story about Stanton Glantz being in New Zealand, and he was talking to at some university in New Zealand, and was speaking to legislators and policymakers in New Zealand. And at the time, like 2 or 3 days later, Greg Hunt was on TV and was giving a speech and said something about vaping. And I was like, I guarantee you, when Stanton was in New Zealand, he took a commuter flight into Sydney so that he could talk to Greg Hunt, because he was parroting everything that Stanton was saying. And it just saddens me that, you know.
Well, that's the narrative here. You know, even at the highest level, our chief medical officer in Australia published on the Health Department website a huge story about E-Valley, and how, therefore, we shouldn't be allowing vaping in Australia. And a whole lot of medical professionals in Australia we organised a letter to go to the chief medical officer saying, well, actually, this is the evidence. You really should update that website. That is still there. That information is still there on the health department website saying, EVALI, all the great risk of lung damage. That's why we're not allowing vaping. We're being cautious about this. It's still there in spite of that.
I think we got H all riled up. He says they have no evidence for funding for Colin or any other pro-vaping health, but we do have damning evidence that many of the naysayers and their institutions are hugely funded by pharma and or Bloomberg et al. I mean
that's okay. Yeah.
But
as I said, they can't argue on the evidence. They have to find some other way.
All they got to do is a little innuendo. That's all it takes.
Yes.
To besmirch somebody's reputation. It doesn't take any evidence. It just takes a few well-placed words and a little bit of doubt. And the gentleman from New Zealand that was in one of those hearings was an older gentleman. He was a doctor of infectious disease or something like that, and he was the head of the WHO's Department on Infectious Diseases or something like that. And the first thing they said to him was, well, we see that your opinion on vaping differs than the WHO, and you don't work for the WHO anymore. Why are you not with? Did they fire you? I mean, they were immediately trying to put some sort of doubt over, hang some sort of black cloud over his head when he was testifying, so that they could figure out a way to counter anything and discredit him. Yes.
And as we will often say, that they're using tobacco industry tactics. I mean, there was that whole story, The Merchants of Doubt, the book about the tobacco industry and how they try to create doubt about the evidence against smoking.
Yes.
And how they deliberately spread doubt. And that's exactly what the tobacco control industry is doing now. They're trying to spread doubt, enough misinformation, often enough, and people think, well, yes, I've heard Colin Mendelsohn, but I've also heard about that, and the Heart Foundation, the Lung Foundation, they respected organisations. They should know what they're talking about.
Yeah, and we talked about that pre-show. The reason the general public, there was a study done. It was a poll in 2016, and they asked, thousands of people, is vaping safer than smoking?
Mm-hmm.
And at that time in 2016, 70% of the public knew that vaping was safer than smoking.
Mm-hmm. Yeah.
And then they repeated that again in 2019, and the inverse happened. 70% of the people polled responded that vaping was worse than smoking.
Yeah.
And in just 3 years' time, they completely changed the public's perception just by, innuendo and mays and mites. You see a lot of, I just saw a thing yesterday, a tweet yesterday. Somebody was responding about or posting about popcorn lung, and Dr. Charles Gardner responded. That's why I saw it, because I follow Charlie, and it came up on my feed, and I'm like, what? Again? Do we have to talk?
It still keeps coming up in Australia as well. Yeah.
And I'm like,
enough people will still be influenced by that. Oh, they'll have heard about that, and they're still talking about it. Maybe it is true. I'm just not sure. I better not go there. That's how they're operating. It's very sad.
Bronchiolitis obliterans, which is that's the scientific name or scientific term for popcorn lung. If you say this, if you say the scientific name, if you actually say that, it sounds horrible. Bronchiolitis obliterans. It sounds like it causes your lungs to explode. I mean,
it's a serious disease. Yeah, it's a serious disease. But it's nothing to do with vaping. That's the whole point. It's just like EVALI has nothing to do with vaping, and COVID-19. They tried to link that to vaping as well.
Yeah.
and yet, more and more the evidence is showing that vapors actually are less likely to get COVID, and being a vapor doesn't increase your risk,
No.
and nor your risk of passing it on.
And now I do want to make sure that people understand that because you vape does not mean that you're immune. Because we do know a couple vapors that were hospitalized.
They're less likely to be, quitting smoking is the best thing they'll ever do for their health. So that goes without saying.
Well, like you say in that video, nothing is better than fresh air.
Yeah,
which is absolutely true. And I would never tell somebody that didn't smoke, start vaping. I wouldn't do that. I mean, there are people that would say, and I fully support people's choice to make whatever choice they want to make, but I would never promote vaping to a non-smoker.
Yeah. And look, I think people who choose to smoke, knowing the risks, again, that's their decision. I mean, and we were talking about this again before about the harm principle, that adults should be allowed to make up their minds to do something that for them is of some benefit, but harms no one else. And it's not the government's job to step in and tell them what to do. But there are actually very few non-smokers who take up vaping on a regular basis.
Statistically,
in most international surveys, it's less than 1%, and of course that's played up by the anti-vaping brigade and made out to be a much bigger problem than it is. It's actually a very small problem. And when you're talking about the risks of vaping, you really need to be comparing it to the alternative, which for more than 99% of people is actually smoking. And so it's a no-brainer.
Yeah, I mean, for years, and it's changed a little bit now, but for years, every bit of science that we could find about nicotine was linked directly with smoking. There was, I mean, obviously there's a couple guys, Paul Newhouse and a few other people have been doing science on nicotine for a long time, but most of the science had nicotine tied directly with smoking. So if anybody wanted to look up nicotine, there was no research on nicotine by itself. It was always in conjunction with smoking. And that could have muddied the waters for sure.
I'm sure it did.
But I would imagine that, that since every study had to do with smoking, that there's a lot of people that are that nicotine is misunderstood just because of that. But I mean,
it is the addictive component, and we used to.
Well, I'm addicted to oxygen, and there's no harm to me breathing, too much. I guess there is, but if you're addicted to a substance that really does no harm, then why is it a bother?
Exactly.
I mean, obviously, we've done the neuroscience, so we understand that nicotine does actually really good things. I mean, I'm ADHD and I'm diagnosed obsessive compulsive, and I don't take any meds.
Yeah. That's one of the many conditions that helps. And we know that nicotine, when you separate it from the dirty delivery system of smoking, we know it's much less addictive in vaping. So that many studies now that have looked at how addictive is vaping compared to smoking. Nicotine is a lot less addictive because smoke has other chemicals that make nicotine more addictive. And the levels rise more slowly and to lower levels, and therefore the addictive potential of it is much less. And we don't even I don't like to say it's actually addictive. It's more of a dependence thing, because addiction means it actually is doing you harm. And you're using it knowing it's doing you harm. Nicotine actually does very little harm, with normal use.
I mean, if you have a obviously it is a stimulant and it does increase your heart rate and does do some other things internally. If you had a heart condition, or there are cases where it could potentially be hazardous, but by and large, in the average human being without any comorbidities or anything like that, no. And the sad truth of the matter is, we had, I mentioned Charlie again. We had Charlie on the show, talking about if people that smoke have difficulty quitting smoking. A lot of people have difficulty even reducing the amount of smoking that they are doing. When they switch to vaping, we see people titrate themselves over time to what they want. So I've been vaping for 11 years. I started at 36 and then I went down to 24. I spent a good amount of time at 18 milligram and I've been at 12 milligram for about 5 years. And that's the level that I need, what I call my maintenance dose. And it keeps me normal.
Yeah, I'm not even so fussed about the amount of nicotine, to be frank. I think what's going to do harm, if anything, from vaping is all the other chemicals. I mean, if you're inhaling big clouds and at high voltage systems, you're going to be making more chemicals, and that's the concern.
Yeah, I think we know that aldehyde production. The hotter you hit it, the more aldehydes that are produced, and VG on its own, when hit with a certain temperature, actually starts outgassing some fairly unhappy chemicals. But I mean, that's like 500 degrees. I don't know if anybody that vapes at 500. I mean, I'm sure that it's possible, but the potential risk is excessively low in the normal range of human usage.
Yeah, exactly. And I think that's a really important point, because we're always being shown studies where they've used excessive doses under artificial conditions, often in animals, in test tubes, and then they try and draw conclusions for humans in that, for which there's no justification.
Well, I mean, I have some pretty awful pictures about how they actually force these, test rodents to inhale vapor. It looks pretty Spanish Inquisition. It's pretty bad. But again, we had Charles on the show talking about putting a rat in a box by itself and giving it a button to give it nicotine. And if it's alone and it's by itself, these are social creatures. It would hit the button, but you put it in a box with a couple other rats where it has somebody to hang out with and, be social with, and they clean themselves and they, have relations and do things, and they don't ever push the button.
Yeah. And rats actually are much more sensitive to nicotine than humans. That's another factor. One thing that we're very clear about is that adolescent mice shouldn't vape. I think the research is very clear about that. Yeah. But, human adolescents, there's no evidence that nicotine harms their brain, affects the brain development. There is just no human evidence. And all the millions of smokers, over the years, who are now hundreds of millions of smokers, there's no evidence of any harm over the long term compared to people who didn't smoke.
Well, let's look at it this way. In the say the 1940s and 50s, there was a substantial rate of smoking in the world. And look at all of the scientific progress that occurred during the 40s and 50s. If nicotine was a problem, there's photographs of Oppenheimer and
Einstein
and all these guys smoking a pipe or a cigar or a cigarette. If nicotine was a problem, I think that we would have stunted our growth, and it seems like we made pretty good scientific progress over the 40s and 50s and 60s.
Yeah, for sure.
So yeah, it's just ridiculous to me. And obviously here in the States, we're in a pretty rough situation. We're seeing, regulators sending out denial letters for regulatory purposes, and, somewhere around 400,000 applicants in the last week and a half or so are being ordered off the market, which is going to reduce access to legal products in the United States. And even though Mitch Zeller said in 2016 at the Senate Help Committee Vaping will never be a black market product. There will be no vaping black market. We already know that illicit markets always show up when government intervenes and decides that it wants to remove something that people like from the market. I mean, during Prohibition in the United States, alcohol prohibition, what happened? People found ways to get what they wanted. I mean, it's that pleasure principle. It's that people are going to try to get what they enjoy.
Yeah, if there's a demand, people will find a way. We just don't seem to have learnt that lesson. It's extraordinary, isn't it? Prohibition just doesn't work, and yet we keep trying to do it. It's nothing's going to change.
It's a frightening thing, when we have people. I mean, obviously, I don't want to get too crazy into the politics here, but we live in the United States here where it seems like the government no longer wants parents to be parents. That the government feels like it is their duty to raise your children for you so that you can just be friends with your kids and not be mom or dad. Personal responsibility seems to be something the government doesn't want people to take upon themselves.
We constantly have this battle in Australia with government overreach, the government going too far, thinking, well, they've got responsibility for this and for that, and telling people how to live their lives, and commonly they just go too far. And unfortunately, the more they do it and get away with it, the more they think they can do it.
If nobody, and I've been, like I said, I've been vaping for 11 years. I've been active in vaping advocacy for 10 years. I started vaping and found out pretty quickly what was going on. And this was in 2010. The government had just lost their lawsuit against Satara in the United States, which was Enjoy. And, millions of dollars worth of product was sitting in customs and was seized because the FDA had ordered customs to seize those because they said they were combination medical devices, and they were unapproved medical devices. And, we had this huge lawsuit here in the States in 2009. And the judge said, no, I mean, you can't seize this because they're not marketing this as a medical device. They're marketing this as a tobacco product. You can attempt to regulate this as a tobacco product. And the FDA basically thought that meant the judge said, go ahead and regulate this as a tobacco product. And they didn't go through any of the thinking processes that you would decide. Do you want to regulate this product? Can you possibly successfully regulate this product with your agency the way it is? I mean, FDA has about 1,000 employees in the Center for Tobacco Products, the CTP. There's about 1,000 employees. And they got 4.5 million PMTAs to process, 1,000 employees. And then even if they could possibly, get through this approval process, you have 1,000 employees to regulate however many products that actually achieve approval in 50 states. In America alone, there's over 200,000 convenience stores that are actually part of the convenience store union. There's even more convenience stores that are not members of the union. How in the hell does any government agency that is completely funded by the sale of tobacco products, let's not forget that, the CTP is completely funded by tobacco user fees from the tobacco companies. How in the hell could that small agency realistically regulate vaping products when they can't keep cigarettes out of kids' hands?
Yeah. I mean, the decision to call vaping products tobacco products was absolutely absurd, and it's unfortunately led to a lot of the trouble that we're seeing in the US. But you mentioned legal cases. There have been a number of legal cases internationally which have actually worked very well in favour of harm reduction. So in New Zealand, Philip Morris took an action against the Ministry of Health because they banned their heated tobacco product. And the judge overruled the government and said, look, this is a product that's beneficial for health. it's against the legislation for you to be blocking this. Same thing happened in Canada, and there was a case in Switzerland as well. So there are legal opportunities because the government is overreaching, and when you look at the evidence, clearly they are undermining potential health benefits for the people in their country. So there are opportunities there.
Now, do they sell the IQOS in Australia?
No, they can't sell it. You can bring it in, but you have to make a special application to customs, fill in a number of forms, pay a huge amount of tobacco tax because it is a tobacco product.
Yeah.
You can't sell snus, but again, you can order it online. You have to pay a huge amount of tobacco tax. I mean, the tobacco tax is about $1,500 per kilogram. So it just makes it, ridiculously unrealistic because they regard it as a tobacco product.
Well, they are,
Well, it is, but
it's like it's pasteurized tobacco essentially.
Yeah, it's like nicotine replacement products. I mean, it's tobacco, but it's a harm reduction product that is saving lives. And we've seen
I've got a can of snooze here somewhere on my desk. There's a can of General Snooze here. So obviously this is Smoke Free Radio is the network that I run here, but I don't advocate only for vaping. If somebody takes a patch, if somebody uses a patch and it works for them, well, you know what? Great.
Yeah.
If somebody uses Wellbutrin or Chantix or Champix, damn, that's awesome. I don't have any problem with that. But none of those products are being banned or illegalized, or criminalized. So I don't have to worry about advocating for them. Snooze here in the States, we finally got they got their modified risk tobacco approval, which means that they can make certain health claims. I think mostly it's and even IQOS got their MRTP through. They can make reduced. They can't make reduced. They got an adjusted MRTP, which basically says they can say using this product gives you less harmful chemicals than smoking does. Because I'll tell you, I liked smoking. Like I really liked smoking. I smoked cigars. I smoked cigarettes. I had a pipe. I had several pipes. I'm a collector, so and I enjoyed it. If IQOS had been introduced into the market 11 years ago, I could very well be sitting here using an IQOS because I like tobacco flavors. I like smoking. But I'm, and Kevin, my normal co-host, he's also a tobacco vapor. But I'm not going to sit here and say, well, I got what I want, so I don't have to fight for you.
Yeah, exactly. I think
this is not about what works for me.
Exactly. And as a clinician, I'm very conscious that we need to have a range of products available. So some people can use Champix or Chantix successfully and are happy with it. Others can't. And we have Wellbutrin and we have nicotine products, but the success rate of those products is actually really low. Like as a doctor,
6%.
Like with NRT, 6%. Even Chantix is 15% after 6 to 12 months.
And that's with comprehensive counseling, right?
That's right. So, we need a range of products, and we have to have things that will work for people where those things don't. And a lot of people do like smoking, and I think one of the benefits of vaping is that you can still enjoy that smoking experience. People say, well, I'm not going to quit because I enjoy my smoking. It helps me to relax. It's a social thing. I just enjoy taking time out. Well, you can do that with vaping. And I think
it's a sensory experience.
There's all those sensory experiences, and the habit, with a cup of coffee, it's really enjoyable, or a drink. You can do all that with vaping, and it will get you off the cigarettes, and you'll still have the enjoyment. So what's the problem?
Well, it's the prohibitionists and the Puritans.
Yeah. Oh, you're not allowed to enjoy it. Yeah. No, that's certainly a factor.
Jeffrey asked a question in the chat. He says, what happens with synthetic nicotine products in Australia? Is there a difference? Or does the government of Australia even recognize a difference between, tobacco-derived nicotine and synthetic nicotine?
No, they don't. Well, they've said in the latest regulations, anything which contains, like for the customs law, anything that's got nicotine is regarded as a tobacco product.
I mean, only in the States did the delineation occur that vaping is a tobacco product, and they have the language specifically in the bill that specifically says tobacco-derived nicotine. I have a feeling, and this is an unpopular, I've said this on the show before, if you put regular tobacco-derived nicotine in a mass spectrometer or under a electron microscope, and you look at an atom of nicotine derived from tobacco, and then you get a synthetic nicotine molecule, and you look at it, it's identical.
Of course.
And there's absolutely no way for FDA to actually differentiate between natural nicotine and synthetic nicotine, and they're just going, I believe, in my opinion, is they're not going, since they can't prove it, and you can't prove it because you're not the lab that actually manufactured it. They're just going to regulate you just like they do regular tobacco nicotine.
Yeah. And if the laws don't allow it, there's no reason why they can't change the law and say, well, we're actually not allowing synthetic nicotine either. And I think that was a potential loophole in the FDA regulations, but they are just as likely to very unreasonably ban that as well. And just
I actually was on a conference call in 2014, the day after the deeming regs was what they call the ANPRM, the Advanced Notice for Proposed Rulemaking, was published on the Federal Register. So here in the United States, there's a period of time where there has to be an advance notice and public comment can be made. And during that period, there was a conference call with FDA leadership, and a lot of vaping advocacy people were there. And one of the people specifically brought up synthetic nicotine or nicotine derived from another source. And at that time in 2014, they said, we fully expect to regulate those products as well.
Yep. Okay. There you go.
There's been some amendments to that. There's been some changes to that language and maybe some hemming and hawing. But at the end of the day, I believe that they will just try to regulate it. And if you sue them, then they'll see what happens. But I fully believe that they're going to enforce and regulate on synthetic nicotine like they did regular, or what, like they're planning on doing with regular nicotine products or tobacco products here. And it is what it is. And I've been pretty accurate. 2 weeks ago, or last week even, I had a Canadian flavor manufacturer, the company that manufactures the flavor additives, and he felt like FDA wasn't going to do what they did this week. So I'm my crystal ball is still pretty accurate, and I'm pretty confident when I say that if they said it in 2014, if they said that they intend to regulate it, here we are in 2022. I feel like they're going to regulate it.
I think you're right. Yeah, I mean, you mentioned Canada, and Canada is going through a really tough battle at the moment. And, we're struggling in Australia, but, that could well be the next step here as well. They might decide to ban all the flavours. They might decide to reduce nicotine content to 2%. And the nicotine content won't hurt people like you, but there are a lot of people. I mean, we use a lot of pod devices in Australia, which need to be 50-60%, 60 milligrams per mil. And they're important transition models. So I think what they've done in Australia is a lot of the vapors have imported litres and litres of 10% nicotine, which they use for mixing. So in Australia, we do a lot of mixing because you can't just go into a local shop and buy pre-mixed nicotine. So people bring in concentrated nicotine. You like that? Is it 100? I can't.
That's 250.
250. Yeah. Okay. Well, the maximum you can bring into Australia is 100, but people that bring it in, it's much more dangerous. It's much more risky. But that's what they're being forced to do. And the thing is, if you don't have a prescription after the 1st of October, there is a fine of up to $222,000 for bringing nicotine through customs.
And how many regular consumers that are going to be importing nicotine can afford a $222,000
Well,
fine?
exactly. So a lot of people are just going to be too frightened to do it if they can't get a prescription. A lot of people don't want to get a prescription. Why should they? I mean, this is a consumer product replacing an existing consumer product. They don't want to be medicalized. They don't want to go to a doctor. They just want to.
I mean, when you go to the doctor, you're basically admitting to yourself that there's something wrong, that you're sick.
Yeah.
You know, just because you
Yeah.
want nicotine does not make you sick.
Yeah, and the doctor's going to say, well, have you tried Champix? Well, maybe you should try it again, because that's what they know. That's what they do. And that's what they've been trained in. So, there are going to be some very unpleasant conversations in medical practices, some angry vapors, and I think it's going to be very harmful. And even if you get the nicotine into Australia, you have nicotine without a prescription, you're committing a criminal offence. So if you potentially could get a criminal record. In 3 states, you can go to jail for possessing nicotine. There are fines up to $30,000. I mean, it's absolutely ridiculous. And that's the pressure.
A bastard in the chat room wants to know, how do I get a script during lockdown? Question mark.
Oh, you do it online. So if you want a script during lockdown, you can actually, there are doctors like me who will consult you by video and provide a prescription online. So that is available. But really, if this was a medical condition, people should be seeing their own doctor. I mean, we don't want people going here for this service, there for that service. Right. The doctor's core business is helping people to quit smoking. They shouldn't be getting a script from here and a service from there. It should be all from their own doctor.
Well, it just seems kind of sketchy that you would have to, that your doctor can't do that for you, and you have to go to another doctor, and then your doctor doesn't know what that doctor prescribed. And I work in healthcare, and it's already bad enough when different specializations and the GPs don't communicate. And then you go see your checkup, you go see your doctor for a checkup, and you bring all of the pills that you're taking. He's like, who wrote all these prescriptions?
Yeah. Well, we call that the fragmentation of medical care, and we know that that's really bad medical practice. But that's what this current arrangement is creating, more fragmentation.
Bruni says that Dave Dorn needs 20 or 72 milligram over a few years. He was down to 12 milligrams. It is getting smokers started on vaping. That is important. Blocking higher than 20 milligrams will stop many from becoming vapors.
That's right, and it will eliminate a whole category of vaping products. So the products with the small batteries, the vape, the pod vapes, and the disposables. They just won't be. We can't use them anymore, and they're great transition models.
I'll tell you this. This is something, because I started vaping on freebase nicotine at 36 milligram.
Whoa!
And the devices that we had in 2010 are very similar to these pod devices that they have now, low voltage, and I have a Sigalike here. This is a modern Sigalike with a tank system. It's made by Joytech. It has 18 milligram freebase nicotine in it, and it still provides a quite satisfying vape. It's the problem is I think when nicotine salts were introduced to the market, all these vape companies that produced 18 or 20, 24, 18, 12, 9, 6, and 0, or 3 and 0, stopped producing the 24 and 18. And then when nicotine salts hit the market at 60, and in some places almost 70 milligrams, the Juul is advertised at like 60, but it's actually like 68 or 69 milligrams when they tested it. I think people could be satisfied with an 18 milligram freebase, but it's not as smooth.
It's not smooth, but also the pod devices and disposables are so easy. So for a lot of the smokers I see, they just want something simple that's like a cigarette. They don't want to have to fill it up. They don't want to have to change coils. They just want to be able to put it in their mouth and inhale. And when it's empty, either throw it away or just stick a new pod on.
Mm-hmm.
And all the discrete cigarette-like models have high nicotine salt concentration. When
Yes.
it works really well, it's smooth and it gives them a quick hit. People can't believe how much like smoking it is, they often tell me.
Mm-hmm. Yeah, and I don't personally. I've tried nicotine salts. I don't like the way my body feels when I've used them, and they're so smooth. Somebody that vapes frequently and often doesn't get that throat hit. They don't realize what they're doing, and the next thing you know, they're nick sick. They've got a little head buzz, and they're a little bit more jittery.
Yeah, I'm not sure how common that is, but I mean, you certainly don't get the throat hit, but not everyone wants that. Certainly at the beginning, you might want that. But the higher concentration still should give you a throat hit, not as much as the freebase.
Yeah, I don't. I actually want. That's what I want. I want that freebase. I want that.
Well, exactly, and you should have a choice. You should have a choice, and there are those people who don't want it, and they should be able to have it without.
Yes. So it looks like people in the chat room are talking about loopholes and nicotine flavor shots and short fills and different things like that, which are different models that work in the EU in different countries. I know in Greece they do short fills, and you add your nicotine, and that's a way to get through the Greek tax. There are the thing to me is, if I found a 60 or 70-year-old person that was a smoker and they wanted to quit, and I took them to a vape shop and they were told, hey, you have to buy this, but then you have to buy this to put into that. To them, that just seems sketchy. It seems like, well, why can't you put it together why do I have to buy all these different things separately? And then if you say to 60, 70-year-old grandma or grandpa, well, the government doesn't want you to have that, and we're teaching you the way. Oh, you have to order your nicotine from China. That just
make it as hard as possible. But you can buy a cigarette just down the road, and it's far too easy to get your cigarettes. In Australia, nicotine's illegal, but they've specifically exempted nicotine in tobacco cigarettes. The poison standard says you can't have nicotine. It's a criminal offence. It's dangerous stuff. But what kills you, of course, isn't the nicotine. It's what goes with it in the tobacco cigarette. They've made a specific exemption for that. Now, that just doesn't make any sense.
No, and again, your NRT products, are they age gated in Australia?
Well, that's the other funny thing. You can buy flavoured nicotine replacement therapies from the age of 12 just from the supermarket or from the petrol station.
And
so nicotine is okay. That nicotine is apparently quite good for you, but the one that we use in vaping is not.
It's not good, no. I've actually had agents all over the world go to their supermarkets and take photographs of the nicotine gum and the patches and lozenges and at what shelf level they are at on display in the stores. And usually it's about eye level for toddlers.
Yeah. And true in Australia as well.
And they have wonderful fruity pictures of fruit on the labels.
Yeah. But why should vapors have flavors? Apparently that's not necessary, but it is for NRT, and that doesn't make any sense.
Well, the NRT thing always made me kind of question why they were, specifically the patches. So, Nicoderm, which is the largest patch in the United States, I believe, and I think it's like 22 milligrams.
21 milligrams.
21 milligrams. So I was pretty close, just right off the top of my head. But all of the science that I've been able to find on nicotine patch and NRT success pretty much shows that the patches of higher concentrations of nicotine are more successful than the 21 milligram patches that are like 36 and 40. I want to say there's a 46 milligram patch that are the higher concentrations of nicotine in the patches obviously is more successful, but they're not commercially promoted. They're not, those are not the ones that seem to get the shelf space and seem to get the name brand recognition. It's almost like they're purposefully selling a product designed to be less successful. And if they followed the science on the nicotine patch itself and the nicotine, delivery over time, that the higher concentration is more successful.
Well, the Cochrane review looked at the dose of nicotine in patches and its effectiveness. They found that 2 patches, which is 42 milligrams, was 14% more successful than 21 milligrams. It's not much of a difference, and that's because just giving people a steady dose of nicotine is not doing it for them. I mean, it's not giving them the little kicks and buzz, and it's not giving them the hand to mouth.
You can't roll it up and light it on fire.
Exactly. So, yes, it works for some people, but it's clearly not enough, and those people need vaping.
And there's literally been no innovation in NRT products in the last 25 years.
Yeah.
Like it's the same product now that it was 25 years ago.
Yeah,
and it doesn't seem like they're willing to make them. I mean, they obviously know that at best, traditional NRT is only 6% successful. They know that. And if they really were interested in making a more successful product, you would think that they would get into the lab and test out some innovation. And they haven't done so because they know it's lucrative.
Then people might stop smoking, and they wouldn't need to keep coming back to use these products.
And pharma likes to sell their patches.
They do. And they definitely don't like vaping. No. Because vaping would compete with their products. But would mean they couldn't sell their products to treat emphysema and asthma that results from smoking. So
I mean, we obviously know. I mean, there are some pharma companies that have patented vapor technology. They just haven't released it. They haven't put them out on the shelves yet. But I mean, they know because we've been paying attention to their science. We've been looking at their patents, and they're registering vapor technology products as pharmaceutical products.
Okay. Yeah, right. Well, in Australia, they certainly oppose it. So Pfizer and GlaxoSmithKline put in submissions to parliamentary inquiries opposing vaping because it competes with their products. They'll give other reasons, but they are very clearly, they're powerful and they're lobbying against vaping, not for health reasons, but for commercial reasons.
Oh God, yes. No, I mean, obviously they have a fiduciary duty to their shareholders to make money.
That's true.
And
so do tobacco companies.
Yes. And I don't care. I'm not mad at the tobacco companies. Look, I was born in 1972. The Surgeon General's report in the United States had been out for years by the time I was born. Every pack of cigarettes that I ever purchased had a warning label on the side of it that said that smoking's bad for me. I made that choice. Nobody twisted my arm. Nobody made me smoke a cigarette. I mean, they never lied to me. By the time I was able to hear and understand words, I knew that smoking was bad. My parents both smoked, and my eyes would turn bright red and start watering when that was near my parents because smoking was so bad. But when I got older, got used to it, I started smoking.
Yeah, all of your parents did it. And what age were you when you started?
12.
Right, so young and stupid. See, the question is, were you able to make an informed choice at that age?
No. I mean, obviously, I knew. I mean, I remember knowing that that it was wrong, that I shouldn't do it, that the cigarette pack says on the side of it. I could read. So
Yeah.
I don't particularly blame. I don't say that they lied to me. I see a lot of people that are my age or younger saying that the cigarette companies lied to them. They never lied to you. They lied to your grandparents.
Yeah.
They maybe lied to your parents. You're supposed to learn from their mistakes, and if you don't, it's not their fault. It's your fault.
And this is another issue with vaping, though, the mistrust of the tobacco companies, and they have been appalling in the past. But there's now this distrust that says, well, if they're involved in vaping products, it has to be a bad thing, and therefore we have to stop it. And that's part of the problem. And according to one of our senior parliamentarians just tweeted yesterday, hello, this is big tobacco trying to get more nicotine dependent young people to replace the dying smokers. That's what vaping's about. And look, I don't care who makes these products as long as people stop smoking. If tobacco companies are switching from deadly cigarettes and making money selling much safer alternatives, that's great. But people just want to destroy the tobacco company, and that's their primary goal for some of them.
Last week, I'm trying to find the tweet. Last week, 31 31 attorney generals in the United States. That's the top attorneys, the prosecuting attorneys in the states, signed a letter demanding that FDA immediately ban flavored tobacco sales. I'm gonna put the tweet up here. It says the Truth Initiative says, we applaud the actions of 31 attorney generals, including Josh Stein, AG Doug Peterson, and calling on FDA tobacco to regulate e-cigs and oral nicotine products by prohibiting flavors, including menthol, and limiting nicotine content, marketing restrictions, and age verification. So in the United States, it's already illegal for anyone under the age of 21 to purchase tobacco products, including vaping products, right? So for me, in my mind, I'm seeing that 31 attorney generals, these are the top prosecuting attorneys, the top law enforcement official in every state. 31 of them are basically admitting they're not doing their job, because their job is to enforce existing laws. And if the laws are being broken and minors are getting tobacco products, then they're doing a bad job, and they need to, don't blame FDA. Don't say FDA is not doing their job, because you're the ones not doing your job.
Yeah.
It's already illegal for minors to have these products.
And that's one of the reasons I wrote the article about youth vaping in Australia. There's this huge panic about young people vaping disposable high nicotine products.
It was about 3%.
Well, less probably. And the concern is that this is being used exploited to undermine vaping. So we should ban vaping because, look, all these kids are doing it. They're all getting addicted. But the problem is that this is an illegal product being sold openly in convenience stores all around Australia. No one is doing anything about it. It's almost like if they stopped it, then they would lose that argument that, the kids are vaping and we must ban vaping. But it's not difficult just to send in the inspectors and shut these places down. But they're not even making that effort.
No, I mean that would solve the problem.
Yeah.
If they went out and they arrested, fined, shut down, whatever, the bad actors.
Yeah. If they're really concerned, that's what they would do.
Comprehensive enforcement of the laws that you already have. Why would you need to make more laws that you can't possibly enforce if you're not already enforcing the ones you have? I'm this is Son of Liberty Radio, so I'm not keen on more rules. I'm sort of a freedom guy. I sort of want to do what I want to do, as long as what I do doesn't bother other people. Leave me alone. If I want to go over to my liquor cabinet right here and grab a bottle of bourbon and start drinking bourbon, that's my choice. That's my freedom. I'm an adult human being. And I enjoy that. Why would I ask you, the people that I voted for, to start making more rules that limit more of my freedoms? Because this is America, and we're all about our American freedoms.
Freedoms, yeah. It's true in America. It's true in Australia as well. But governments have that tendency to overreach. and it always gets them into trouble, but they keep doing it.
Yeah, I saw a story a couple weeks ago. It's been maybe a month ago, and they had these big stings, these big arrests and seizures of illegal tobacco products, where people were growing their own tobacco. How dare they?
Oh, shocking!
How dare they plant a plant in the ground and grow it? How dare they?
Well, I think the biggest problem is they're not getting the tobacco tax, of course.
Yeah.
That is quite a serious matter. I do understand that. Yeah.
I guess it's illegal for an individual in Australia to cultivate tobacco.
Yeah, it is illegal. Mm.
So
yeah,
here in the States, it's illegal for you to make your own liquor and sell it. But you can make your own liquor for personal use.
Yeah.
But if you sell it, that's where the tax law comes in, and they say you owe us money.
Yeah. That's when they start getting really upset. Yeah.
Because it's all about the money. Well, in the United States, the very first two things that were taxed in the United States from the founding of the United States was whiskey and tobacco. We actually in 1780, 1790, we had what they call the Whiskey Rebellion, because the government decided to tax whiskey, and a bunch of Americans were not going to stand by and let the government tax their whiskey.
Yeah.
We sort of always like to start wars over taxes. Back in the old days, they tax our tea. We're going to have a party in Boston Harbor, and we're going to raise some hell and start taxing our whiskey. But tobacco was our first cash crop in the United States. It was the first tax that was ever collected in the United States that actually brought the federal budget into a positive.
Okay. Well, certainly these days there's a lot of moral issues here. I mean, these are regarded as sin taxes, alcohol and tobacco taxes. I'm not sure about it in those days, but certainly that's one of the drivers for taxing these products. And what worries me is that the government in Australia may decide to introduce the same tax for vaping products, because people are using a drug. But on the other hand, it's actually a life-saving product, and it should be taxed at very low levels. I know in the US, the taxes are creeping up in lots of states, and I think that's a big worry.
I see people arguing that if we just let them tax us, they would leave us alone. I don't agree with that at all. I think that they've got a prohibitionist look. They've got an ideological slant that they're not going to. They're just not going to give on this. I don't feel like bowing to some sort of tax. I don't believe that a product that saves people's lives should be taxed in any way, shape, or form more than what a normal retail tax is.
And if you make that concession and say, okay, but you can tax that, then there'll be something else. Then they'll say, well, now we're going to take away the flavors, and you'll give into that. And then they'll say, well, we're only going to let you use this much nicotine. I think it's a slippery slope, and I'd be very careful going down there. I'd fight against every restriction.
Well, it takes an act of Congress to create a tax, but all they have to do to raise the tax the next year is it's a line item on the budget then. And they can actually change the percentage just adding it on a spreadsheet. One of the things that I did recently was I designed a couple t-shirts to do fundraising for some different things. There were some things that I wanted to make donations for, and I created what I'm calling the Son of Liberty Scallywag T-shirt. It's a black flag, a pirate flag, but on the back of the shirt, I included quotes from one of my favorite writers, H.L. Mencken, and one of the quotes on the back of the shirt is, "Puritanism the haunting fear that someone somewhere may be happy.
Maybe happy. Yeah. Yeah.
So that
Very
seems to me
relevant. Very relevant.
that is definitely part of the prohibitionist plan or the prohibitionist motivation, is that they're afraid that somebody's enjoying something and they can't be a part of it. I mean, obviously there's the every normal man must be tempted at times to spit on his hands, hoist the black flag, and to begin slitting throats.
Okay.
So H.L. Mencken, he's one of my favorite writers, but I couldn't memorize the quote right off the top of my head, so I had to pull the T-shirt up. But the Puritanism, the haunting fear that someone somewhere may be having fun or maybe happy.
That's a big issue with vaping, and that's why we can't talk about recreational vaping in Australia. We can't mention that people are enjoying it. I've written articles where I've referred, like for various journals and for doctors, and referred to this issue, this enjoyment issue, and the reviewers have said, no, you can't have that. This is a medical treatment, and we can't have people enjoying drugs. You're encouraging people to take drugs. They just don't get it, unfortunately.
Well, and like we were saying, like I was saying about psilocybin a while ago. Actually, there's they have Netflix in Australia. There's a documentary,
The mushroom documentary.
Yeah, there's a documentary on Netflix called The Magic Mushrooms.
I was watching it last night.
It is a wonderful documentary.
Amazing. Amazing. Yeah.
Even if you just mute it and you just watch like the photography in that and watch the mushrooms growing and things, it is an amazing documentary.
Amazing.
And, it's shot very well. But I shared it on Twitter like 2 weeks ago. I had watched it. I was sitting here on an evening, and I just randomly selected it and started watching, and I'm like, this is a very good documentary. And I mean, I already knew that it was being used for self-improvement by some people. I myself, I work in healthcare. I could be randomly drug tested at any time. So I have friends that work in the hemp industry and work in CBDs and work in THC, and I can't use any of their products because I could be randomly tested at any time.
We can't have you enjoying yourself.
No, we can't have any fun. I mean, I used to work in pediatrics, so I can understand a little hesitancy. I wouldn't know. I don't know that I would want to. I would trust anybody that could possibly be under the influence of something if it was my kid. And that's probably a little hypocritical, because I understand what the hell's going on in your body when you take things like this. It's just, one of those ingrained fears.
The pediatricians are amongst the biggest opponents of vaping, of course.
Yes.
They
were one of the signatories to the lawsuit.
Yeah, right. And look, it's interesting that, because it sort of shows you how people's priorities and values influence this debate. So if your focus is purely on the health of young people, then you may take a position that anything that harms young people is totally unacceptable. So even if it saves millions of lives, if it harms one young person, it's unacceptable. And I think we often see that kind of difference in values and priorities coming up. It's like the respiratory physicians are also huge opponents to vaping, and their argument would be, well, anything that harms the lungs, we can't allow that. You can't take that into the lungs. It's doing this and that. They're not looking at the bigger picture. I think it's just their priority is the lungs, and end of story.
You have to look at risk versus reward, and what your harm threshold is. So there are people, and specifically PAVE and Truth and a couple of these organizations that believe if one child uses this product and becomes a habitual user, then they have to throw the 2 or 3 million full-time American users of these products under the bus. There's no acceptable risk threshold.
Trade-off. Yeah, there's no trade-off.
Yeah.
They're sort of focused on the one issue, and really health policy should be based on the net good to the community. Unfortunately, a lot of people don't think that way. And a lot of these single interest groups dominate the debate.
let me see real quick. They did the World Health Organization presentation, about 3 weeks ago, where they had they brought all these youth advocates out, and they had Dr. Tedros, and they had Bloomberg on, and in the intro clip for tonight's show, there is a clip of a youth advocate, and a youth anti-vaping advocate. He's actually the son of one of the founders of PAVE. And he, he's basically saying, I'm going to play the clip. How about that? I just played the clip. I got to find the clip first, but I'm going to find it. Because he basically says in the clip, if you tell a kid not to do something, then there's every incentive for them to do the thing that you tell them not to do. So this is a World Health Organization presentation. This is the child of one of the founding mothers of PAVE. So that's a little context. So here we go.
Clearly, when you tell teenagers not to do something, there's a good chance they will do it.
Caleb, did you ever take up smoking or try any e-cigarettes as a result of that presentation, and that because of peer pressure perhaps from your own friends?
So I certainly, in my time in high school, with vaping being so prevalent, I cannot say that I've never used it. And I think that there should be no shame associated with using any of these products because they're just so prevalent in high schools. But a lot of my peers use these products. I've experimented with these products.
So this is one of the PAVE kids. He's admitting to using these products.
To see that
using any of these products because they're just so prevalent in high schools. But a lot of my peers use these products. I've experimented with these products.
Yeah, interesting. And it's so interesting to see that, that they were sort of saying, we're not targeting you. We don't want you to be a customer. But ultimately, as you said, if you tell a teenager, don't do something, there's every incentive then to kind of go and do it as well.
So they just worked that out.
To me, this is a World Health Organization presentation. They've trotted out they had 3 youth advocates that were on, anti-vaping advocates on the show. They bring out the child of one of the founders of PAVE, who basically says, if you tell a kid not to do something, they're going to do it. So they're basically he basically negated the entire program that the WHO is doing. I mean, it's all about just say no.
Just say no, yeah.
And we know just say no doesn't work.
Yeah.
And obviously, most children are going to test their boundaries. They're going to do the things that their parent, it's rebellious child thing. It's, all children need to learn the limits. And they're going to do things that they're going to experiment. They're going to do things that they're told not to do. So
the great majority of them, certainly in Australia and I know in the US, are only experimenters too. They'll try it like he did. And we talk about all these kids who are vaping.
I experimented and I stopped.
Yeah, and most kids do.
So it must not, apparently it must not be nearly as addictive as heroin as they said it is.
Yes, isn't that? It's amazing. It must be, or he's just very strong.
Yeah, or the fear of his mother telling him not to do it.
Yeah.
But I mean, to me, I would have thought that the WHO would have vetted the comments that the presenters were going to give, because he's basically saying everything that you are doing, all of your entire tactics, your entire campaign doesn't work, because it does the exact opposite. If you show kids a vapor technology and say, don't use this, that's essentially marketing to kids.
Well, that's what the FDA has been doing in the US, of course. All the kids are doing this. It's terrible. All your friends are vaping. Look at all these cool images. This is what they look like. Well, hello. We're all very aware where that's going to lead.
Yeah, it just seems to me like maybe WHO should have thought about what they were doing before they did it. But that whole entire presentation was full of nothing but innuendos, mays, mights, and coulds. Oh, well, this could do this, and this may do this, and therefore it has to be banned and demonized and othered. Obviously, here in the States, I don't know what they do in Australia, but here in the States, if you smoke, you can't do that around other human beings. You have to go over there. You are socially ostracized if you're a smoker.
Oh yeah.
But every other addictive thing. Now the new status quo is that we need to be sympathetic. If you're a heroin users are using heroin because they're broken. There's a problem. We need to embrace them. But if you're a nicotine user, if you're a smoker, you got to go over there. We don't want to be socially. We don't want to socialize with you. We want you to be over there with all the other subhumans.
Yes.
I mean, that's what it feels like. I mean, and if you're a smoker,
sending a negative message. Yeah.
If you're a smoker, you are one of the lowest of the low in the social stratosphere.
Yeah.
I'm glad H put some stuff up. A couple weeks ago, CASA and CAFRA got together and built a website called righttovape.org. Right? I tried to send that address, www.righttovape.org, as an instant message to Kevin, one of my friends, Kevin, the co-host of the show. And Facebook Instant Messenger blocked, in a private message, blocked righttovape.org as hate speech or misinformation.
Oh, wow.
So I went through a couple-day process on Twitter, got a lot of other people. The organizers of the website actually appealed because I couldn't even post it on a public post either. But I could understand if they were blocking it because of their tobacco policy or whatever, even though it's bullshit. I mean, righttovape.org is a repository of people's quit stories.
Yeah.
Right? They're not marketing any specific product. They're not marketing tobacco products. They're asking for people to put their stories about quitting smoking in one place so that we can capitalize on everybody's testimonials. I could understand possibly that they could say that it goes against their terms of service. Possibly. But to block it in a private message was...
Yeah, that's amazing. But the social media platforms are very sensitive about vaping. I mean, and AFRA at one stage had, as a charity, we got funding from Google Ads to do ads about vaping, to refer people to our website and to give out information. And one by one, the ads got shut down because it breached the policy of their tobacco policy. And we kept writing in saying, but we're telling people to stop smoking. This is actually a pro-health message. But they didn't seem to understand the difference. And my Facebook page account got shut down about 2 months ago, and I wasn't able to open it again. I had to start a new account and start from scratch again because of this ridiculous, and you can't appeal against these things.
Well, I mean, Right to Vape actually did appeal and got the ban of their website unblocked. So now you can actually post on Facebook that URL and send people to righttovape.org to submit your testimonial. And people should definitely, I'm not a member of INCO and I'm not a member of CAFRA, and I am a member of CASA. But I want everybody in the world to know my story, and I want to be able to read people from around the world's stories. So there should be.
CASA's got thousands of
I mean, my testimonials are theirs.
Yeah, how many has Right to Vape got so far? They're probably building up, but
I don't know. I'll look. Let's see if it says. But it just seems odd to me that it's so, like Holly says in the intro video, it's so weird, when she talks about their hate of vaping. What did I do wrong? Oh, I mistyped. It was a typo. It happens. I'm sure H is the one that just shared the link. He could possibly have been there faster than me. Oh, Pippa says 15,000. There's 15,000 testimonials already on. Well, and H says over 14,000. So somewhere between 14 and 15,000 testimonials already.
Wow.
See, the
never
thing
mind,
is,
they're only anecdotes. I mean, they're not scientific evidence. I just want to be clear about that. Yeah.
13,963 to be exact.
Okay, great. That's great.
And there's the thing is I've been doing this so long. I have a Word file that I have that is a evolving document. I've been writing letters to politicians for 11 years or over 10 years. And I actually I don't know. I'll check Bastard. He asked if YouTube is blocking it. I'll post it in the sea. It apparently went through because it's right there.
Good.
That I use, and I can actually go through the Word file and change language here and there for whatever purpose that I'm writing the letter for.
Yeah.
So I already have it like a 3-page testimonial already written. That I could just cut and paste right in there. And I suggest to everyone that uses these products that is passionate enough about these products to print out a letter on your computer, because I don't like email. I know for a fact politicians really don't take very much effort to delete an email. But a letter, on the other hand, legally has to be submitted to the historical archives. Every piece of mail to every politician in the United States must be saved. So I always say print it out, sign it on the bottom with a real pen, put it in an envelope and mail it. Because I mean, they're legally obligated to save it. I mean, they may not read it, but
at the end of the day, it's a political decision. You know, vaping, the laws around vaping, the politicians are going to decide, and that's really our main target. We tell vapers to go and visit their local members of parliament, take along a couple of friends and explain it to them. They probably won't take any notice, but if 100 people from their constituency come along and emphasise that this is a vote-changing issue for them, then they're going to take notice. I mean, they're driven by self-interest like anybody else.
See, the single issue voter thing, and I've deconstructed this multiple times on the show. See, the problem is that the vaping demographic is as diverse as the smoking demographic, because anybody that possibly could have smoked in the past could be a vapor now, and we have white vapors and black vapors and gay vapors and straight vapors. Every possible combination of human being could be a vapor. And politically, here in the States, it's been sort of understood that this was a right versus left thing, which it never really was. But that was sort of the story that was pushed. And we sort of never really engaged with the left as directly as we did with the right. Because it's a freedom thing, and it's a liberty thing, and it's a small business thing. And those are all right-friendly things. But if we had addressed this as a human rights thing, if we had addressed this as a harm reduction thing 8 years ago, we may not be in the situation we are in now. And it's really hard in the States here, at least, to say that, in most cases, Republicans, which is not all Republicans, but in a lot of cases, we're a Republican-friendly topic. But if you had a trans or a black or a gay vapor, it would be a hard sell for them to say, hey, vote for this guy because he's pro-vaping, but he's also the guy that protected the police officers that's put their knee in the back of that guy's throat and killed him because he was selling loose cigarettes on the street. So it is difficult to push the one issue voter thing because the politicians here know it's a weak argument because they know that we're as diverse as we are and that we could never get all the people on the same page.
Yeah, for sure. Look, there are certainly voters who do work on the one issue. I mean, there are people, lots of people you would know who have tried for years to quit smoking and have finally done it. And then for someone to try and take that away from them, it's a huge issue for them.
Yeah,
but so for some people, it's a huge issue.
For some people, it is a huge issue, and for me, I'm a gun guy. So we already talked about guns a while ago. I'm going to vote for the politician that is going to allow me to keep my firearms and is not going to limit my choices when it comes to tobacco harm reduction products. But if it comes down between a politician that says, okay, I'll let you have your vape, but I'm going to take your guns, we might have a problem.
Okay.
And if you're into body autonomy and you're a pro-choice advocate and you got a pro-life guy that says, I'm going to ban your ability to have an abortion, but I'll let you vape. That's going to be a problem,
What's happening with Biden and vaping?
Well, Biden, when he was a candidate, he said, I'm going to follow the science. Now, his vice presidential candidate said, we're going to ban all of them. So as far as I can see, nothing. Like he's made taken no active role in what FDA is doing. Obviously, a lot of the leadership in his party are anti-vaping. And, a lot of them recently wrote a letter to the FDA saying, do your job and ban menthol cigarettes and ban flavors in vaping. But he hasn't really done anything. I think that they need to upgrade his Exelon prescription. I think he's forgotten what he said he was.
That could be a factor.
I'm just saying. I don't want to make it too political. I mean, I didn't like either of the options that we had in the last election. I think I've been quite transparent on the fact that I didn't like Donald Trump and I don't like Joe Biden either. I didn't like any of the options that we had. And I don't think either one of them are great leaders. Trump was kind of I think he would have been okay if he'd just kept his damn mouth shut. But since he can't control his lips, he's an embarrassment for our country in international circles. So I didn't like him. It wasn't really a thing. He said, I'm going to ban vaping, and then he had his meeting, which was a great thing. He actually sat down and had a meeting with leadership, vaping advocacy, and vaping manufacturers, and obviously PAVE was there as well. He said some intelligent things in that meeting. He seemed like he understood the topic, but then he turned around and did nothing. So
that's politics, isn't it?
Yeah.
They do what they have to do.
He was trying to make his wife happy because I firmly believe that his wife caught Hunter, the boy. I think his name is Hunter.
Yeah.
The boy vaping. That Secret Service, there is a rumor that Secret Service got him a Juul, and that I think she caught him vaping, and that caused her to tweet something, and then the very next day, Trump followed suit with the tweet, and then somebody pulled him in line and said, "You need to sit down and have a talk with these people before you ban their products." But it seemed like he understood the situation, though.
Family factors could play a role. Our deputy prime minister smokes, and his partner, mother of two of his children, is a vapor, and he supports vaping. But it's all very political. I mean, there still has to be a vote in the party room, and he has to get majority support. But we're disappointed that he hasn't pushed harder for vapors' rights. Because it's a family issue for both of them.
Yeah. Sadly, the the right to vape is not a constitutionally protected right. It's not written in the Constitution. I mean, you could argue that the pursuit of happiness, which is an inalienable human right according to our Constitution, would encompass vaping, because vaping makes me happy.
Yeah.
But
you also have a right, according to the World Health Organization and the UN, to optimal health.
1D.
And,
there's actually a human health rights charter.
Yeah, in the charter, the World Health Organization charter, and in the Human Rights Charter from the UN, you have a right to optimal health, and I would have thought that would be sufficient to allow people to switch to something at least 95% safer, but apparently it's not. You have to keep smoking so they can have their taxes.
Yes, and like I said, the FDA has made their announcement today. They banned another 300,000 products today, 50-something thousand the other day. There's still people getting letters in the mail. It's not just those, and they're slowly but surely whittling away the rights to make those choices. And that's disturbing
for us too in Australia, because we obviously follow what's happening in the US. I mean, the Australian politicians are going to say, well, in the US they're banning vaping, or they're restricting it harshly.
Well, they're banning all the flavors.
Watching.
They're reducing the successes. So if tobacco is the only flavor, people like me that enjoy tobacco, as long as it's a well crafted tobacco flavor, we'll be happy. We'll be fine. But they're screwing out. There's I'm 1%. 99% of the others, I think it's actually 70%, prefer non-tobacco flavors. But they're destroying the success of this product, because 2 years down the road they can say, look, we banned flavors and now there's fewer vapors. We did the right thing.
Hello, but the smoking rates have increased.
Oh yeah, but look at all of our master settlement agreement payments here in the States. Look at our MSA payments. They're so much better now.
Yes. It's a win-win no matter what they do.
All of our potholes are getting filled, because none of that money, or very small percentage of the MSA payments that are made to the states, are actually made for tobacco education programs. The vast majority of that money goes into the general fund, and they use that to fix potholes and to pay politicians and to pay their bills, but because they can't quite understand how to actually craft a balanced budget. Yeah.
When they eliminated flavors from Juul, my understanding was, the kids switched to other flavors, and mint. So it's hard to know. And in San Francisco, of course, more kids were smoking after they cut back on the flavors. It's just evidence. They just don't seem to accept it.
I mean, even if you point it out to them, there's a guy in Australia who I've just put on the ignore list. I don't even look at him anymore. But a lot of vapors, and not just Kiwis and Aussies, but American people, they interact with this guy, Tahir Turk. They interact with him. They respond to him. And I'm like, he's irrelevant. He's a guy that teaches public health campaigning in social media, and he has less than 200 followers. How successful can he be if he's a social media guy? He's doing public health in social media, and he only has 200 followers on Twitter. You're just giving him more fuel. Just ignore him.
Right. There's only so much time that you can spend on this.
But I mean, it's directly on his. I found his LinkedIn profile. Like, he has a LinkedIn profile. I went to his LinkedIn. Like, it's right there that he works for Bloomberg.
Right.
And I'm like, why are you even engaging with this guy? He's just catching a check.
It's a waste of time. That's for sure.
So, I mean, engage with the people that are going to be beneficial to engage with, possibly educate, and maybe turn them around. But he's one of those people that are never going to turn around, because he's catching a check.
Well, also, I think we don't waste a lot of time arguing with rusted-on anti-vapors. There's just no point. I mean, the ones you need to target are the ones who are sitting on the fence, and they're the ones whose mind you might be able to change. So in terms of campaign resources, you've got to optimise what you've got.
Mm-hmm.
And the same with parliamentarians too. And our view is we need to target the marginal electorates, because they're the ones who are going to listen to their constituents, to their voters.
Well, and prior to the show, you and I were talking, and I said that I don't believe that people purposefully get into public health to screw up public health.
Mm-hmm.
I firmly believe that they get into it with the best of intentions.
Mm-hmm.
And then they get in there and they get brainwashed by the old guard that are there before them. This is how we do things. And then they become unwilling or unable to change tracks. Like they're zeroed in on a target, and all they know is full speed ahead, and don't touch the steering wheel.
Yeah. Well, there's too much risk, isn't there, of going on your own? I mean, you lose funding, you lose career opportunities, you lose support of your peers. You'd be out in the cold very quickly. That's just how it
we've
works.
seen it. I mean, look at Granny Louisa in the UK. She heard about vaping, was adamantly anti-vaping, decided to look at it. I don't know if one of the UK academics maybe approached her with some science and said, take a look at this. Next thing you know, she independently researches it and finds out, hey, I was wrong. And
not many people change their mind, do they? Now,
but I mean, now she's a hero in the UK for the the stop smoking protocols, and she's one of the biggest proponents for vaping in the UK. And then even look at like Mara. Mara was tobacco control. She was a tobacco control insider.
But look at the price. Look at the price she's paid.
Well, yeah, she changed ships. She did the same thing as Granny Louisa. Granny Louisa is a hero in the UK. And Marawa is an enemy of the state now.
Well, in the UK, they do have a different attitude to harm reduction. They've always been in favour, so it is a more friendly environment. But yes,
I mean, Ray Nyora obviously was also a tobacco control guy. He was the head of Truth or one of those organizations, and now he's smart guy. David Sweener, same thing. Cliff Douglas just recently this year did an about face, the SRNT 15. So I mean, we're getting some of these. See, here's the thing though, the SRN 15 guys, they're 15 retired guys. They're not worried about their careers anymore.
No, they can do it. But you think it would carry some weight. It hasn't got any publicity in Australia.
I mean, I've seen Time Magazine mentioned it in one piece today or yesterday. But it was in the middle of the text. It wasn't pointed out. It wasn't like, they didn't put a neon sign on it and say, look at this. It's there, but and then Cliff Douglas, he's a academic in University of Michigan or whatever. He's no longer the national leader of any organization like he was before, American Lung Association. And, they can't punish him.
No. So he's able to speak up.
So now he's able to speak freely, but it doesn't carry the weight in the general public that it would once have. Paul says that we're being geo-blocked. Are we being geo-blocked, or are you guys in general being geo-blocked in Australia? I know that there is a sort of a news block on certain websites in Australia, but my show better not be being geo-blocked in Australia.
Not sure what he means.
I mean, I know that there's some news stories that were being blocked by certain outlets that were not readable. Farsalinos and Pelosa and Ash UK and Marawa and Helen Bald are all of them being ostracized. The Farsalinos thing is just so comical because it's so blatant, like the amount of like misinformation and lies. Yeah, Linda, lies that Bath is putting out, and you're like, it's so blatant that it's a lie. How could you possibly even publish that? I mean, but yeah, it's people will understand. People
get away with that. They kind of, they have the funding to promote themselves, and
I mean, Bath is a pretty big university. It's a pretty prestigious university. It's not Harvard, it's not Oxford or whatever. But I mean, if Harvard were to come out tomorrow and publish a paper full of lies about vaping, people would believe it because it's on Harvard letterhead. It is what it is. Well, Doc, I think that we've covered everything.
I think it's time for my lunch.
Do you have anything else on the horizon that you're going to be publishing, or?
Nothing to mention at the moment. So there is some exciting news coming up, but I can't talk about it right now. But look, I'm confident that we'll win this debate in the long term. But it is going to be a fight. Yeah, it's going to be a fight for sure.
How many people are going to die between now and then?
Exactly. Yeah, it is urgent, isn't it? I mean, people are dying every day, and every day you smoke, you lose 6 hours of life. So the more people we can switch as soon as possible, the better. So,
here I'm gonna show you a Kiwi. I'm gonna show you a proud Kiwi vapor. That's Tom Morowitz from New Zealand.
Yes, I've seen that picture. Yes,
and that's my T-shirt he's wearing. That's the Son of Liberty Radio T-shirt. All the way down in New Zealand, in the NZ.
And that's an interesting point, that just across the Tasman, our Kiwi cousins, are all in favour of vaping. And for some reason in Australia, totally different rules apply and different science applies, and we have a totally opposite view. It just shows you how, with the same evidence, different governments make totally different decisions. It shows you it's not about the evidence. That's a classic example of that.
Yeah, I mean, if the Royal College of Physicians in the UK come up with a scientific consensus, studying all available science, and say that vaping is 95% safer, then why is that being ignored in literally every other country on the face of the earth?
Yeah. Well, I think we agree on that. That's for sure. Yeah.
So I appreciate you coming, Doc. You're welcome to come back anytime. If you publish something and you want us to promote it, we'll do that.
Okay.
We have the same arrangement with Dr. Glover and Charles, if he ever wants to come on. We like having scientists on the show because it makes us it lifts up our show, because otherwise it's me and Kevin on the show reading stories and opining and sometimes getting angry. When you're on the show, I don't curse, or I very rarely do. See,
I'll take that as a compliment. Thank you.
I
might take you up on that other offer for later. I do have something exciting coming up, and I'd love to talk to you about that. So, thank you so much for asking me, Patrick. It's been a great honour, and I hope it's been useful to the viewers. Yeah.
What I always ask before everybody says goodbye is to just what is the one thing that you want people to go away from this show with? What is your final thought?
Look, our final thought is that we just have to keep fighting for the rights of vapers and for public health. There are millions of smokers out there. We have to also keep in mind it's not just about the vapers and their rights. It's also about getting those other millions of smokers to switch across to vaping. And I think for that purpose alone, we just have to keep fighting this, and we will win. There's no question we will win this debate in the long term. But the more we put into it and the more political pressure we can bring to bear, the faster this will all change. And I think that comes down to, a mass movement of people and educating the public, putting pressure on the parliamentarians in our case, and we will get there. So we need to all keep hanging in there. And there's a lot of good advocates I know that's looking from Australia, people like Pippa and Bruni and so many others.
Nancy is, she's in New Zealand, but
New Zealand. There's so many
Yolanda.
Yeah.
There's Tom Morowitz is in there, Bruni.
Mm.
So a lot of people from all over the world are on the show right now.
I mean,
listening.
and unfortunately, it's a limited number who are actively involved. But I think we need to get more people actively involved to really make a difference. And
the wonderful thing about this show is that we do it live on 3 different platforms, and that allows us to get the video out. And as soon as I'm done with the show, I download the audio and we upload it to about 30, somewhere between 30 and 40 different platforms. It goes to audio. And we get another 10,000 people a week listening to the show all over the world. So
look, it's fantastic. I mean, with people like you and Pippa and some of the other people who really put themselves out, it makes all the difference. And we just need more people doing that. So thank you for what you do, and keep up the good work.
Thank you, Doctor.
Okay, thank you.
There's a little button down on the bottom there.
I'll leave the studio.
Yes, sir.
Okay.
You have a good night.
Nice to meet you.
I am so happy that we finally got Colin on the show. This week has been a pretty awful week for us. I mean, I don't want to come up here and say I told you so, but I mean, I've been saying for 2 years that this process was never designed to be fair for open vaping companies. That it was designed specifically to crush small mom and pop businesses. And, there are still a few companies that are still in there, but, it's more than a few, but, it seems to me like what FDA is doing is they're getting rid of anything that has the word flavor in it. That's what it looks like. I mean, I've seen one of the companies on that list today is not a small company. Nickwood is on that list, and it's not a tiny company. I believe I saw Nick Orlando's company on that list. I could be wrong, but I'm pretty sure I saw that one of my sponsors is on that show or on that list. It hurts me, but we have to do anything and everything to save people's lives. And if that means that we're going to fly the pirate flag, we're going to provide the safest illegal product that we can, we're going to save people's lives. I am not about to give up. I don't imagine anybody that watches this show is going to be willing to allow people to die because some government agency says it's illegal to save people's lives. It is Labor Day weekend here in the States. So we get a 3-day weekend. We're going to enjoy ourselves when we can. So y'all have a good weekend. I love you guys. Kevin will be back, I'm sure, next week. Like I said earlier, he's had a big tragedy in his family. Send your karma his way, good karma and well wishes. And just be good to each other. And like I said, we'll be back in 7 days. And I'm sure between now and then, there's going to be a lot more bad stuff to talk about. But I'm glad that Colin came on because that steered me away from another week of negativity. I mean, Colin didn't bring great news, but having somebody that doesn't smoke come on this show and promote vaping, somebody that is a healthcare provider, an actual doctor, come on and say positive things about vaping, it means the world to me. And I hope that you guys understand the value of having people like Dr. Colin Mendelsohn and Dr. Alex Wodek and Clive Bates and all the other people that are there. I'm just, at the point now where we have to be firm in the fact that we're not going to let people die. Y'all have a good weekend. Enjoy your 3 days if you're here in America. Tuesday, you're going to have to get up and go back to work, but we'll be back next Friday. And then then we'll start the angry words and the cursing and the words of rebellion and just screaming for blood. But anyway, y'all be good. Love you. And we'll see you in 7 days. Bye.
We're exporting a whole lot of really bad and dangerous rhetoric, bad research, and unfortunately it's being picked up and amplified in other countries.
Never forget the elephant in the room. It's actually such a big elephant that I don't think people can even breathe in that room. It's such a huge elephant. It's number one reason of the number one preventable cause of death in Australia. So when you are taking a precautionary approach, when you're like, no, we just don't know enough, I just tell them, shut up, because that just, I don't know, is killing people right now.
So we know that vaping nicotine is not risk-free. Nothing's as good as fresh air, and nothing's risk-free. But the Royal College of Physicians in the UK, Public Health England, have reviewed comprehensively the literature and have found that, concluded that vaping nicotine is at least 95% safer over the long term than smoking cigarettes.
It's not about really quitting smoking. Their ideological viewpoint against vaping is so strong and so weird. Like, honestly, it's just weird. I don't know why it invokes this incredible sort of anger from these people. I mean, this colleague of mine said to me when I first moved to get the inquiry up, her comment to me was, why don't they just use a patch? And I said to her, do you smoke? And she's like, no. I said, have you ever smoked? And she said, no. And I said, well, shut up then. You don't know how hard it is to quit smoking.
And unfortunately, we're putting people in the choice of either being criminals or running the risk of a 2 in 3 death from smoking. And we shouldn't be putting people in that position.
No. Clearly, when you tell teenagers not to do something, there's a good chance they will do it.